Welcome to Women's Health, the OBGYN podcast. I'm your host, Alexa Economos, along with Dr. Tillman from Health Central Women's Care. And today the topic is fibroids. So Dr. Tillman, I'm kind of embarrassed to admit that I don't know exactly what fibroids are. I've heard of some of my friends who've had them. I've clearly never experienced them, but I don't know what they are. So can you explain what it means to have fibroids?
Sure. Well, fibroids are benign tumor.
Benign,
usually muscle tumor of the uterus. So if you think about it, you get a lot of benign growths all over your body. You can have a little skin tag, or you might have a mole, and that is similar to what happens in the uterus. There's some irritation on one muscle gland, muscle cell, and it just grows and grows and grows to different sizes. But 99% of the time, they're benign.
Okay, so when you hear the word fibroids, the message is don't panic, but it will need treatment. So before we get to that topic, what causes fibroids in the first place?
Well, that's a good question, but they don't really know. So they have some things that are associated with it. For example, high estrogen amount. Some people think that high meat diet, that's sort of more holistic approach, but they really don't know what causes fibroids.
If like my mom had fibroids or my grandmother had fibroids, do you think that I would be more likely to also have them? Is it possible that they could be hereditary?
There is a genetic component, actually. A lot of women over 30 will get them, so age is somewhat included in that. But also African Americans, for example, have a higher propensity to have fibroids.
Why is that?
They don't know.
They don't know.
No.
But I would imagine they're doing more research to try to get to that answer. What about?
Probably not.
No.
No, because it's a women's issue.
Yeah.
Sorry, I just
No,
have to do a
that's
little
okay.
political
And,
statement there that just, they've had known fibroids for a long time, but not a lot of research is being done. Even though we are doing research in our office about treatments, there is not a lot of research being done about the cause.
And isn't that something? And I understand what statement you're making, because it's not just apparently research into fibroids that we talk about, but it's also the changing guidelines regarding mammograms and whether insurance companies will cover them, or the recommendation will be at the age of 40 or the age of 50.
Exactly.
And so there is sort of that, I understand,
Right.
speaking frankly, that underlying statement that sometimes we probably don't feel that enough is being done. And I think that as women and as moms, I know you're a mom, sometimes we do tend to put our health care last, which would probably account for why a lot of women don't understand what perhaps fibroids are, like me, in the first place.
Right.
So if you are diagnosed with fibroids, is there just like one kind, or are there several different kinds of fibroids?
Yes, there are several different kinds depending mainly on the location in the uterus. So some are in the muscle of the uterus, they're called intramural. Some are submucosal, inside the lining of the uterus. And subserosal fibroids, those are on the outside of the uterus.
And is that what serosal means?
Like the lining of the uterus. So, and some of those serosal fibroids can be pedunculated, sort of hanging on a stalk, like a thin connection, but they're like swinging on the edge, on the end of a string. But all of those fibroids can show up anywhere in the uterus, and the type is based on location.
We talked about who is at risk of fibroids. I mean, we're talking about pregnancy, possibly family history, African American. How would you know is it obvious if you have fibroids? What symptoms would you be experiencing that would tell you this is a fibroid issue?
Well, for patients, they might start to experience pressure in the pelvis, pain during their cycle, or heavy bleeding. Those are the three most common
And you're talking
symptoms.
about heavy bleeding during menstruation, or are you talking about like in between?
It can be either. Some of the fibroids that are on the lining of the uterus can bleed in between, where some of them can bleed with your regular cycle as well.
You know, a lot of us sometimes experience lower back pain, and we think maybe that's just the pains of growing older or, working or just being a busy person. Is that possibly something that could be a sign of fibroids as well?
It can be. Sometimes if they grow extremely large, they can start to compress the nerves that are on the back of the pelvis, and you can have referred pain to the back.
Okay, so when you say extremely large, now you have me wondering, because I admit I watch Grey's Anatomy. So how large, how small or large can fibroids be?
Well, the smallest one can be the size of a pea, but you can also have large ones that can be the size of a football.
Have you had patients or read about cases where a patient was living with this for a while and didn't necessarily know it, having a large
Yes,
fibroid?
they didn't know. I mean, I had a patient whose fibroids actually came up to her xiphoid, which is right under her breast.
Ooh.
And she just was so afraid of surgery. She wouldn't want to do anything about it. But yeah, you hear a lot of people in other countries too who may have not known, and they just come to be evaluated from a long distance, and then they have these huge tumors and they're fibroids.
Unbelievable. So when you talk about patients coming to be evaluated, how exactly is that diagnosis made?
Well, usually we are initiating the evaluation because on a pelvic exam, we may note that the uterus is enlarged. So just basic pelvic exam may be the first sign that you might have fibroids along with the patient's symptoms. But the actual diagnosis is made by most commonly an ultrasound, and we do that in our office. Or sometimes you might get the diagnosis by an MRI, an incidental finding if they're looking for something else. But the best way to diagnose is by ultrasound.
So you mentioned some patients immediately think, okay, I've got the diagnosis of fibroids, now it means surgery. But
Right.
that's not true, is it? There are many forms of treatment for fibroids.
Right. There are a lot of things you can do. I mean, the first thing that I do is actually wait and observe, because unless you're bleeding heavily or you're in danger of needing a transfusion or something, most of the time you have the luxury to wait and observe to make sure that the fibroids are not growing rapidly or changing, causing more symptoms. So the very first option is waiting. Secondly, you can take some medicine if your main issue is bleeding. Like sometimes we'll give you birth control pills, some other hormonal manipulations to stop the bleeding. Because that's probably one of the most common problems that people have with fibroids.
And dangerous, it sounds like, if it's left unchecked.
Exactly. And we also are doing some more research in our office with Discovery Trials on some new medications to treat fibroids, like oral medication you can take to help stop the bleeding. So those are the non-surgical type of treatments.
What about people who like to take a really holistic approach? They want to change their diet, they want to do kind of exercise. Would that really work?
Well, it depends. Some people, they have had some success with it. They won't get rid of the fibroids. Let's make that clear.
Okay.
They'll still be there, but they can manage some of their symptoms on the holistic side. They recommend decreasing your diet, decreasing your stress.
Oh, that's so easy.
I know, especially for women,
Eat less and don't be stressed.
Yes, while you're taking care of your family and
I
working
didn't know
and doing
that.
everything.
Right. But what about, like, I know a lot of women, even when, for so many things, they turn to yoga or acupuncture. Are those, Now, as one doctor said, is that voodoo medicine or
No,
does that
I
really work?
honestly do not believe that Eastern medicine is voodoo medicine. We just don't know about it. Let's just
Yeah.
put that on the table. I think that there's a lot to be gained from Eastern medicine. We just don't have the studies to say, okay, if you do acupuncture, it's going to shrink these fibroids. There's no way Western medicine's going to do a lot of research on that. There is more and more looking at combining Eastern and Western medicine, but I can't say for sure, okay, this study proves that acupuncture reduces fibroids, but
Not going to hurt, right?
it doesn't hurt to try.
Yeah.
And also on that same level, just from a spiritual aspect, I know Louise Hayes, for example, she talks about how disease shows up on our body from different injuries that we sustain, you know. And when you look up that in her book about fibroids, it says that it's a person who may have sustained a assault or a hurt from a significant other.
Wow.
And
That can manifest. So you're saying, and I believe this too, I think a lot of people do.
I
that
think so
The
too.
spiritual is directly tied to the physical. So you're saying that something like that could manifest itself physically
Yeah.
into an ailment.
I do believe it, but I just don't think we have proof of it, you know. It's sort of like in Star Trek when they wave the wand over and say, oh, this is what's wrong with you.
Yeah.
We just don't know that technology yet to be able to say for sure, this happened and this is how you got fibroids on this spiritual level. And this is what you need to do for it.
But faith is also believing that which you cannot necessarily prove.
Exactly.
And I don't think that I think that's really a powerful thing that a lot of people who have battled diseases or have gotten certain diagnoses understand when it happens to you that the spiritual is very much connected to the physical.
Right.
So I think that's a really interesting conversation that it sounds like you may have with your patients that would be really helpful.
Yeah, I think that, what the affirmation that she recommends is.
And you brought the book.
Let's
take
just
a
look at
let's
it.
take a look at it. So it's again, and it's the book is. Can we hold it up for a second?
Oh, sure.
There you go. It's You Can Heal Your Life.
Right.
I love that, and it's Louise Hay.
Yes, which we love her. So fibroid tumors is noticing a hurt from a partner, a blow to the feminine ego. And so the affirmation she gives is, I release the pattern in me that attracted this experience. I create only good in my life.
Can you read that one more time?
Sure. I release the pattern in me that attracted this experience. I create only good in my life.
Wow.
And not to
That's
blame
powerful.
the person.
But
This is
to
the thing, to
release it,
To release it.
and that's no easy feat.
It's not. So in terms of treatment, you know, just like dieting or anything else that women struggle with, there's so much emotional and spiritual, psychological component to it, as well as what we can do on the Western medicine side. So that's, I guess, why I believe in Eastern medicine and Western medicine working together.
It sounds like it's a web. It's all
Yes.
interconnected.
Exactly.
And I would think for patients who really want to get the best results from their treatment, they will take a look at both of those components, even if they have to resort to surgery, which I know is oftentimes the case with fibroids.
Right.
If they had to do surgery, what does that all look like?
Well, first of all, fibroids is the most common reason women have a hysterectomy. So that does.
And a hysterectomy, to remind everyone, is just, it's everything. I mean, it's the.
Well, it's
Well,
removing.
You tell me. I'm not the doc.
Yeah.
You tell me.
Well, it's removing the uterus only. That's
Okay,
technically
see?
a hysterectomy.
And I thought it was.
Ovaries, tubes, and
Can I
everything.
say
No.
the full Monty? I thought it was the full Monty. See? Once again,
Well, yeah, that's
here-
good.
a
It's good to have
female
these
not knowing-
conversations.
It is. And I think sometimes we're embarrassed to say that we don't know everything that we should probably know.
Well, that's why it's good to talk, you know. So you can, if you have the type of fibroid that's on the lining, the submucosal kind, you can possibly do a hysteroscopic myomectomy where you actually go through the cervix and you remove it with a small blade and you just cut the fibroid out without any incisions on the abdomen. That usually has to be less than 3 centimeters, though. The other thing is sometimes you have a pedunculated fibroid and you can just twist it off at the stalk. You just twist it until you take it off. So it's pretty simple. And then there is a laparoscopic hysterectomy. We have some people in our office that do that. I don't particularly, but where they can just do through a laparoscope, cut the fibroid out, and then they shred it and remove the pieces. And then you can have what's called a myomectomy, in abdominal, where you make an incision like a C-section, and then you remove the individual fibroids. And all of those are for people who usually want to maintain fertility. So if they've never had a baby or they think they might want to have a baby in the future, that's usually the route that people go. Right. But if you're just done with your periods, done with fibroids, done with it all, and you want the most definitive treatment, hysterectomy, it's usually the last course that people take, though.
So curious to know if you're getting one of these, I am curious to know this first of all, and then I'll circle back to the next question. If you've had a C-section and you are, have to do the more invasive where you have to make that line across the abdomen, can your doctor go into the original?
Yes.
So
actually,
and I know, and women care about this because they don't want to have more scars,
right,
visible scars, than they have to. So for someone like that, it could be done along that incision.
Definitely. And they can even cut out the old incision and make it look great. But yeah, a lot of time
Hey, we deserve it.
Abdominoplasty, all that stuff can be done along with hysterectomy. So there's some other benefits besides actually the stopping the bleeding.
To my second question about the surgery, what would the downtime be if a woman is having this done? What would the range be in terms of how much time off of work? Or
if you end up having hysteroscopic myomectomy, that can be day surgery, and you probably can return to work in a couple days. Wow. If you have a laparoscopic myomectomy, then that probably could require more time depending on how much bleeding there is, and the recovery would probably be more like 7 to 10 days. But if you have an abdominal incision, then just like a C-section, it can be anywhere from 4 to 8 weeks.
Yeah, you have to remember, I think that sometimes we forget this is our core.
Right.
So when you're doing anything in your core, that does slow you down.
It does.
But what's good to know is that there are so many different forms of treatment. And as we talked about, from changing diet and of course spiritual to surgery. But once again, and I know Dr. Staub and I talked about this, it really is such a partnership with your doctor that you are on this journey together and you're making those important decisions together.
That's right. And the main thing I tell people in terms of that is that, sort of like what my mom said to me. She says, whenever you're done hurting yourself, you'll quit. It's not complex. But, the same thing with fibroids. When you've had enough,
you've had it.
You just can't tolerate, bleeding through your clothes, missing an appointment, giving a lecture while you have to be excused to go to the bathroom. When you're done with all of that suffering, then you're ready to change. And I think one thing I want to encourage women to do too is not to just, when a doctor tells you, oh, you need a hysterectomy, I'm not trying to talk myself out of a job, but you have to know intuitively for yourself when the time is. You will know. You will know, okay, I'm done with this. I have so many patients that I just hold their hands while they walk through doing Lupron or doing IUD for treatment or doing pills to stop the bleeding. And then when they're done, they just know they're done. Whether it's just taking the fibroids out or doing a hysterectomy. If you have had informed consent, now that's where the spiritual part and the art of medicine comes in. You have to know yourself, and we have to let you come to that on your own.
And I think that's such an incredible statement, and how wonderful to have that come from your very doctor, to understand that it is a journey. And I do think the body speaks loudly through the spirit, and it's almost like a full circle moment. Like when your mom said, when you're done,
you'll give it up.
You're ready. And I think when you're ready, it can be quite empowering.
Right. And I think the only thing that we have to tell you as doctors is when it's life-threatening. Like, I'm not going to let you bleed to death. Yeah. I'm just going to have to say, if you're having hemoglobin of 5, which is extremely low, I'm really going to take a stand for you to do treatment, whether you need a transfusion or hysterectomy or both. That's my responsibility. That's where I have to take a stand for you if you don't know. And actually, I had a patient recently. I followed her for 3 years. She just was refusing surgery, mainly because she was a busy mom, had a high school student, and this was the end of it. And then she just started bleeding heavily. She came to the ER, where she had to get a transfusion, and finally she said, I'm done. I've had it. But so she finally was able to put herself first, because she was on the verge of dying, of course. But I mean, we don't have to get to that point, but
Sometimes
you do.
Sometimes we don't realize how we don't stop, and we keep going and going, not really fully understanding how serious it is. What is it like for you, sort of on a personal level? I'm talking about this everything.
Right.
You're a mom to 2 children, so you have that balance. You try to probably achieve that balance in your life, and you have a relationship with so many patients. So, what is it like for you when you see these patients go on this journey?
Well, I didn't say in the beginning, but I also had fibroids, which
you buried the lead. That's called burying the lead. You had fibroids.
Right. And
Okay.
I mean, I had them all through my pregnancy. They were very small. They didn't bother me. And then all of a sudden, boom, it grew sort of like almost to basketball size. And I just could not.
Basketball size?
Well, it was one of the hardest hysterectomies
on your
ever.
frame. How,
Yeah.
I can't
Well,
even.
I couldn't pee.
Oh my goodness.
And then I just finally had to say, okay, well, we have to pee, right?
Right. So you were done, as your mom would
I was
say.
done.
You were done hurting yourself.
That's right.
And you realized it was time.
Right. And then my partners did the hysterectomy. So.
My goodness.
And I think
So this is even more personal for you, because you know exactly what a lot of these patients are going through.
right. Just like my patient, I didn't get to her extreme, but I was just busy with patients, and I had this patient, and then
course.
my kids were doing this and that, and then
The time is never
we're
right.
going to travel, and so and I think women just try to do too much, and a lot of times we just need to stop. And on a spiritual level, for me, I think it was God's way of telling me, you just need to stop.
He was like, slow down.
Okay. No, not slow down. Stop.
Okay, stop. Full
Because
stop.
I had to get the full burning bush stop sign to say, okay, this is the way this is going to go.
But do you feel like that's made you an even more powerful human being and professional and a doctor?
I think it gives me a lot more empathy. I mean, having kids, having surgery, going through menopause, all of that makes you a lot more empathetic when the patients are going through it, and you can relate to their journey a lot more.
And I think for patients, and speaking as one myself, I think sometimes it feels like a lonely place to be when you have something that needs doing, and to feel that you're not alone, that you're really not alone, that somebody understands in more ways than one.
Right.
That's pretty incredible.
Yeah, it's great.
Well, it has been so wonderful speaking with you, and
Good.
we're going to look forward to learning more about you in the weeks to come.
Okay. Well,
Thank you so much, Dr. Tillman. Thank you. And if you'd like more information about fibroids or Dr. Felicia Tillman, you can visit Health Central Women's Care. They're on social media and, of course, online at healthcentralobgyn.com. And the handle on Instagram, Twitter, and Facebook is at HealthCentralTX.